Hello everyone. Today I am going to discuss few important questions from forensic medicine for NEET PG exam. The first question is most common organ involved in blast injury is intestine, lungs, eardrum, bones. The correct answer is eardrum. So eardrum is the most common organ involved in blast injury. So it depends on again whether patient is in air or patient is immersed in water or is in solid material. So based on the location, the organs will be different. But the most common organ involved in blast injury overall is eardrum. If patient is in air or standing outside, so most common is eardrum and lung can also be involved. But the most common is eardrum. If patient is immersed in water, so if patient head is out, the GIT is most commonly involved. If there is complete immersion, again the eardrums are the most common organ. If solid material, most common organ is bones. More the homogeneous structure, lesser the injury. So what is the homogeneous structure in our body? That is liver. So liver injury is less in case of blast injuries. So in case of bomb blast, fracture is not a specific feature and the force of explosion is concentrical. So there is something called as Marshall's triad. So it is seen in blast injuries. It includes the types of wounds in bomb blast. So one is abrasion, one is contusion, and another one is laceration. These are the types of wounds seen in case of bomb blast. It is called Marshall's triad. So in case of bullet injury to skull, we will see two types of wound, entry wound and exit wound. So in skull there is something called inner table and outer table. So in case of entry wound, the bullet will first affect the outer table in case of entry wound. So outer table injury will be clean cut and inner table there will be crater formation or beveled edge. There will be crater formation in inner table in case of entry wound, whereas in exit wound the inner table will be clean cut. It has clean cut wound, whereas outer table will be having crater formation or beveled. So in case of bullet injury to skull, there will be crater formation in inner table in entry wound and outer table in exit wound. So the next question is quad hanc refers to impotency to particular female, impotency to all female, impotency to particular male, all of the above. The correct answer is impotency to particular female. So this hanc refers to female. So what is meant by quad hanc? So it will be the person will be having impotency to a particular female, that is he is impotent to particular or single woman. What is quad hanc? So it is impotency to single male or particular male. Hanc means male. So this quad hanc is psychological. It is psychological factor. So if quad hanc is present, it can lead to nullity of marriage. So what is meant by nullity of marriage. So this is nothing but legal declaration by the court that there was no existence of marriage between two people and that marriage was not valid. So we can cancel the marriage. So we can legally there will be declaration that there was no existence of marriage. So this quad hanc can be a factor that can lead to nullity of marriage if he is important to wife starting from the time of marriage. So what are the grounds? What are the grounds for nullity of marriage? First one is non-consummation of marriage. Second one is if the person is minor, if the partner is impotent, mentally ill, and partner is having sexually transmissible disease in communicable form. So if these are present starting from the marriage, if partner is impotent, mentally ill, and is having sexually transmittable diseases at the time of marriage, so this can lead to nullity of marriage. And if partner is intoxicated at the time of marriage, or if that female is pregnant at the time of marriage, and if both are of same sex, and if the marriage is by force or fear of death or by fraud, so we can do these are the grounds for nullity of marriage. So there is something called as divorce or dissolution of marriage. This is different from nullity. So in this there was existence of marriage. Existence of marriage is there, but after marriage, because of some issues, the partners get divorced. That is dissolution of marriage. What are the grounds for this divorce? One is cruelty, if partner is having unnatural sex, or adultery, and if patient is impotent or mentally ill, not at the time of marriage, subsequent to marriage. And one question will come, whether sterility is a ground for divorce or no. Sterility is not ground for divorce, but impotency is ground for divorce. The next question is most common complication of criminal abortion. One is sepsis, hemorrhage, recurrent abortion, all of the above. The correct answer is hemorrhage. So most common complication of criminal abortion is hemorrhage, whereas most common complication causing death is sepsis. So there is legal definition of abortion. What is abortion by legally? So there will be expulsion of products of conception at any time before full term. This is legal definition of abortion. It can be spontaneous or artificial. So in spontaneous, again there will be natural or accidental abortion. In artificial, one is justifiable, another one is criminal abortion. This justifiable is nothing but MTP Act, medical termination of pregnancy. In criminal abortion, it is IPC section 312 to 316. So if we do criminal abortion with consent, it comes in section 312. And if we do criminal abortion without consent of the mother, it will come under section 313. And if criminal abortion causes death of the mother, it comes under section 314. There is something called as intrauterine death. So death of the baby in utero, that is death of the fetus. So rigor mortis is absent in fetus below 7 months. Below 7 months of age, rigor mortis is absent. And we can see maceration of the fetus, that is aseptic autolysis. And we can see mummification, that is desiccation. These can be seen if amniotic membrane is intact. So if amniotic membrane is not intact, then we can see putrefaction, that is there will be bacterial entry. There is no adipocere formation in case of IUD. No adipocere formation. So what is the earliest sign of maceration? What is the earliest sign of maceration? That is skin slippage. We can see as early as around 12 hours. So what are the radiological signs of intrauterine death? Radiological signs. One is Robert's sign. What is meant by Robert's sign? So there will be gas shadow in aorta. Gas shadow in aorta. We can see this as early as 12 hours. This is the earliest radiological sign. Next one is dual halo sign. So this is nothing but there will be increased pericranial pad of fat. Pericranial pad of fat. So third one is there will be hyperflexion of spine. There will be hyperflexion of spine. Fourth one is there will be overcrowding of ribs. So these are the radiological signs of intrauterine death. So next one is Spalding's sign. So what is this mean by Spalding's sign? So there will be overlapping of skull bones. So this is the one of the important question for exam. What is Spalding's sign and what is the earliest radiological sign of IUD? So what is the earliest sign of maceration? These are the important questions. So next question is, stretch laceration is caused by perpendicular force, tangential force, irregular force or horizontal force? The correct answer is tangential force. So laceration is produced by blunt injury. It is caused by blunt weapon. So there will be tearing of soft tissue and it will be irregular and jagged. So what are the types of laceration? One is split laceration or incised laceration. So in this, the direction of force will be perpendicular to the surface. So it can be seen on scalp, on cheek, on chin or on shin. Usually it is seen in that area which is underlined by some bone. So it will be caused by perpendicular force. So next one is stretch laceration. Stretch laceration, it is caused by tangential force. So if this is the surface, it will be caused by tangential force. So we can identify the direction of force. So third type of laceration is avulsion laceration. So it will be deglowing or shearing type of laceration, and there will be horizontal force. And tears, so it will called by irregular force. Fifth one is crush laceration, usually in case of amputation. So the lacerated wound will be having irregular margins and edges will be contused. So apart from laceration, there is something called as abrasion. So here there will be epithelial loss. Only the superficial layer of skin is scraped. So it can be due to scratch by pin or thorn or nail. Only epithelium is involved. Second one is graze or scraping or sliding. So it is most common type of abrasion. It is seen in case of RTAs, where if patient fell down on surface, broad rough surface, it causes this graze or scraping. It is commonest. So third one is imprint abrasion. So there will be short period of contact between surface and the person. Fourth one is pressure abrasion. There will be sustained pressure or there will be long time of contact. So these pressure and imprint, they'll produce patterned abrasion. So based on the pattern, we can find out the material which causes that wound. There is one more terminology called contusion or bruise. Contusion or bruising. So in this, the layer of skin will be intact. The skin layer will be intact. It is also caused by blunt weapon. So example is black eye, which is also called as raccoon eye or spectacle hematoma or panda eye. So there is something called as ectopic bruise or migratory bruise or percolatory bruise. So what is this mean by ectopic bruise? So the trauma will be on one part and bruise will be seen on another part. So bruise appears in a place other than the site of impact. So frontal impact causes black eye. And there is something called as tram or a railway track bruise. So which is caused by a rod or pipe or stick. So there is something called as sixpenny bruise. So it is caused due to fingertips or pulse, sixpenny. So abrasion, contusion and laceration, these are the types of wound usually caused by blunt weapons. So what are the injuries caused by sharp weapons? Based on entry into cavity or other than cavity, there are three types of wounds. So if the weapon is entering into a cavity, it will produce penetrated wound. So if the weapon is entering a cavity, it causes penetrated wound. If weapon is entering the body part other than the cavity, it produces the punctured wound. So if a weapon causes both entry and exit wound, it is called perforated wound. So usually pointed weapon can cause blunt injury or sharp injury. So if it is causing blunt injury, it causes laceration. If it is causing sharp injury, it causes incised wound. So these are the variety of wounds based on the weapons. The next question is, cause of the death in case of cafe coronary can be due to all except cardiac arrest, vagal stimulation, both A and B, asphyxia. The correct answer is asphyxia. In cafe coronary, there are no signs of asphyxia. So this cafe coronary is a term coined by Roger Haugen. So what is this cafe coronary? Usually seen in case of intoxicated persons. So there will be inhibition of gag reflex. So intoxicated patient, there will be inhibition of gag reflex if patient takes any food. So it will directly enter the larynx and trachea. So there will be vagal stimulation, which in turn causes cardiac arrest. So in this cafe coronary, there are no signs of asphyxia and patient will die immediately. So there are some important points in forensic medicine. So first one is ingredients of negligence. These are the few important points for exam. Ingredients of negligence. First one is, there is absence of duty. So if doctor doesn't do his duty properly, it leads to negligence. And dereliction, that is absence of reasonable skill or care. If there is damage, so any trauma to patient. And direct causation. Fifth one is reasonable foreseeability. So this is inability to anticipate the outcome of treatment. So these are the ingredients of negligence. So there is something called as damage and damages. What is meant by damage? It is nothing but the trauma to the patient. Trauma caused to patient. This is one of the component of negligence. What is damages? So this is nothing but the compensation given to a patient. This is compensation. It is not the ingredient of negligence. So there is something called as warning and warning notice. These two are different terminologies. What is warning? So it is a disciplinary action taken against doctor by medical council for any unethical practice. So warning is a disciplinary action taken by medical council against a doctor if in case of unethical practice. What is warning notice? It is code of conduct for the doctors given by medical council, issued to all the doctors at the time of registration. So warning is given in case of unethical practice. So third point is consent. Consent is not required in case of emergencies. It is said by IPC section 92. Consent is not required in case of emergency conditions. It is given in IPC section 92. So what are these emergency conditions? In case of children, in case of incompetent patients like intoxicated persons or mentally ill patients or unconscious patients. So consent is not required. So in these type of patients, consent is not required. We can start the treatment directly. No need of consent of any other persons. So fourth point is what is meant by choking. So there will be constriction of terminal barrel in shotguns. So there will be constriction at terminal barrel. It reduces the dispersion. So what are the advantage of this choking? It reduces the dispersion. In turn, it increases the range. So there is something called as triad of shaken baby syndrome. What are the components of this shaken baby syndrome? One is there will be subdural hemorrhage. Second is there is a retinal hemorrhage, and there will be cerebral edema. So there is something called as Grevious hurt, which is an important topic. So this is done under IPC section 320. So what are the components of Grevious hurts? That is, what are the examples for Grevious hurt? So first one is if there is emasculation, or if there is permanent damage to vision or hearing. So this also include in Grevious hurt. And if there is loss of any member, so what is meant by this member? Any part or any organ in the body that has its own function. So if anything is lost, it is also causes Grevious hurt. So transection of nerve or tendon or muscle. So this is also included in Grevious hurt, which causes impairment of power. Fifth one is fracture or dislocation of teeth or bone. Permanent disfiguration of face or head. And any type of hurt that endangers the life. And any type of hurt so that the patient is unable to do daily work or severe body pain for more than 20 days. So these are some important points to remember in case of forensic medicine. So these are few important points to be remembered for NEET PG from forensic medicine subject. So if you like this video, please click like button. If you want to watch further videos, please subscribe to my YouTube channel and please share the video. Thank you.